Hey everyone, Dr. Erik here from MedBetterHealth, where we talk all things dementia. A question I get asked all the time is, Dr. Erik, what are the possible treatments for dementia? I'm going to take you through the timeline in this video. Are you ready? Let's go. So, in 1997, 29 years ago, because we're in 2026, the first medication came out called Aricept. Aricept. All right, then 3 years later, 26 years ago, a medication came out by the name of Exelon, both of which we still use now, close to 30 years later, right? Exelon is a patch. Okay. Then we're going to skip this one for here. Then you have Namenda. Namenda came out in 2003. Okay, so it's a different type of drug. All right. And then you can take a look from 2003 to 2013. There was really no significant new drugs. The only thing that we did was we took Namenda and we made it XR. Who knows what XR stands for? Extended release, meaning you take the same drug and now it's slowly extending, releasing in your body. Okay, wow, interesting. Then in 2015, a medication that we put together was called Namzaric. Why did I say put together? Well, because we said, hey, let's take the medication Aricept, this guy over here, let's take Namenda, let's combine them together, and we'll have another form of medication, a combination. 2015. So if you really look at it from 1997 to 2015, just not a lot of going on, right? The same thing, combinations, not a lot. Now, for those of you listening, this is the age of incredible things for dementia. There's so many new medications, so much new things going on. So, with this new age, look, this is a dividing line. From 2015 to 2021, not much going on, right? A lot of trials, a lot of trying to figure things out. 2021, a new type of medication comes out. Aduhelm. We're no longer using it, by the way, and I'll talk about it. And then in 2023 and 2024, continuous new medications come out, like really new. And let's talk about these, right? So most people, when you have mild dementia, most people, your doctor is going to first start you off, a lot of the times, this is like the old school thinking, right, is going to start you off on donepezil, a drug from 1997, from 30 years ago. Then, if your dementia progresses and you have moderate to severe and it's kind of growing on you, right, you're going to be giving memantine, again, a really old medication. So why are we, and then, you know, sometimes your doctor will say, you know what, let's use some combinations, like I said, let's do an extended release, let's combine two of these and give that to you. And that's been what we've been doing, right? But now there's a paradigm shift. Why? Because these medications, they actually worked on specific receptors, specific neurotransmitters, right? They worked on acetylcholine, they worked on glutamate. It didn't really work on removing the plaques. In 2021, there was a paradigm shift. The paradigm shift is, hey, why don't we focus on these plaques? Because with dementia, specifically Alzheimer's, there are plaques in the brain. And the theory is, right, which we're testing, is that because of these plaques, our memory gets worse. So, common layman thinking, if I remove the plaque, my memories get better. And that's what we're testing, right? We don't know that for a fact yet where, oh, it's going to completely get back to normal or what's going to happen. We're still testing it, and we have new data, and I'll talk about that. So the new drugs that came out, this one came out, aducanumab, but it was actually discontinued due to concerns over efficacy and side effects. So this one is no longer there. But these two drugs, they're not oral medications. These two drugs are actually infusions. They're IV infusions. So, and what they do is they bind to amyloid and they have your immune system clear these plaques. So I want you to think about it. We have an immune system, and that's clearing the plaques. Where are the plaques? They're around the vessels, right? They're in the brain. And what happens when you start clearing plaques? What do you think could happen? What's a side effect? That's very common. Something called ARIA, ARIA, amyloid-related imaging abnormalities. Whoa, Dr. Erik, amyloid-related imaging abnormalities. What is that? Well, there are two types of most common abnormalities. Number one is when you're taking away those plaques in the brain, your blood vessels, they tend to bleed a bit. So you can get something called hemorrhage. So you're saying, wow, that's not good. Bleeding in the brain. Wow, I'm kind of nervous about that. What else? Well, you could also get edema, a little bit of brain swelling. Huh, interesting. And, well, how do we know? Like, what are we going to do? Well, that's where you have continuous MRI imaging. So you're having specific imaging at specific frequencies depending on the drugs that you're taking in order to see, hey, are there these ARIA, are these abnormalities where it's either edema or hemorrhage in the brain? So a lot of people initially hearing this, you kind of get turned off. And you say, well, I'm not going to do it. But you shouldn't. What you really should do is you should have a real conversation with your neurologist. And you should say, look, I get that these are the side effects. What is the risk of me getting this side effect? What are the benefits? Am I going to get my memory back? No, but I will have a slower progression of my dementia. That's good. By how much time? Now, we're going to record another video that takes a deeper dive into these two drugs, or it's a video in and of itself, so to have you better understand what they are. But these are the types of conversations you need to have. Now, very often, you don't know that you need to have these conversations, right? Because you don't know this stuff. So Medicare came out with a new program that our organization, MedBetterHealth, has been selected to participate. This program is called the GUIDE model, G-U-I-D-E. And this program helps you, the caregiver, who's taking care of mom or dad or anyone else, a person living with dementia, and you got these questions. Now, who are you going to call? Not Ghostbusters. You're going to call our organization. And in our organization, we have two folks who will help you. Number one is your own care navigator. This is where you start that conversation. And then you have a dementia proficient provider. This is a clinician, either a nurse practitioner or a physician, who will guide you and walk you through this and help you understand and connect you to the right resources so you can get the information that you need. So a lot of you are watching, oh, this GUIDE model sounds incredible. You could actually go through this with us and help us? Yeah, well, there's got to be a catch. How much does it cost? Zero. Well, how do I know if I'm eligible? If you have traditional Medicare and a dementia diagnosis, you're eligible. And in fact, if you want to find out if you're a person living with dementia, if they are eligible for this program, very, very simple. You're going to see a link over here. Go to that link. You're going to see a video that talks about the program and all in detail. And on the bottom, you're going to have a survey that you fill out, a questionnaire. You're going to input your information. We're going to check your information, get back to you, and let you know if you're qualified or not. So, see you on the next video where we go deeper into what is lecanemab, what is donanemab, just so you better understand it. I'll see you soon.